I'd like to now talk about our philosophy on dental implants and possibly some options to consider for you when it comes to time to considering dental implants. Basically, what a dental implant is usually some sort of titanium post or something that's placed in your jaw and through surgical procedure, and it's integrated through time, and it basically your jaw and the implant becomes one of the very rigid replacement to a tooth. It's like a root in your mouth, and it's very solid, rigid result. There's three things you might want to consider. Number one, if you place an implant in the smile or an aesthetic zone, you usually get a very nice result with that. You still can consider a dental bridge. Bridges are very nice and aesthetic too. The one thing we've seen in the past sometimes is that when you put an implant in the smile zone, and maybe 3 to 5 years later, sometimes the area near the gum line has maybe receded a little bit, and as you smile real big, sometimes you can see where maybe the implant begins and ends. Doesn't happen always, but that is a consideration to think about. But again, a dental implant in that area is a very nice result, depending on your smile line and the result that the dentist gets. So that's a thing to consider. The second area to consider in dental implants is that if you have a space and you have two healthy teeth on either side, one healthy tooth on either side of the space, that might not be the time to consider maybe a bridge, because when you put a bridge in, again, you have to remove two structures on either side of the space to put the bridge in, where a implant is really a tremendous option to consider when you have natural, untouched, healthy teeth on either side of the space. So it's a real nice replacement for a single tooth. Another option for the third thing to consider is how does it work if you don't have any teeth either in the front or the back, or if you're missing teeth totally. And an implant can be used very nicely to replace multiple teeth. You can use it under dentures to stabilize dentures. And in our office, we see just tremendous result by placing a number anywhere from 2 to 4 implants on the bottom jaw and reconstructing the bottom jaw with a nice new denture. Patients love them. They're stable. They're usually people tend not to eat well when they have dentures, but what the implants do, they stabilize the denture. It gives them a better quality of life. They're able to enjoy, again, biting into vegetables, biting even the apples. So the implants gives you a very stable result, very predictable result, high success result when it comes to replacing teeth that are missing where you have no other options. And that's where the implants are just, the patients just appreciate them so much. And again, the quality of life is just increased when the patient considers the options for implants, and particularly in that area. If you like this information, and if you're interested and would like to learn more about our services and what we have to offer, and even more about our office, you should really visit us on www.drheringer.com.